Brad Chaimson looks at the cost of health care through the eyes of some local residents. Indeed, Brad.
Well, there are limited resources for those who can't afford health care. Madison residents have seen how fragile those resources are. They're hoping reformed health care will help.
Where all did you go to try and get help?
Betsy Knight has volunteered as a parish nurse at Madison's Catholic Multicultural Center for nearly a decade.
For diabetes.
She says when the center was unexpectedly closed in May, her patients had nowhere to turn.
They really wouldn't. I mean, we kept it going by ourselves for a month until it came back, but we could not have kept that up.
Knight helps residents who can't afford help on their own. Some have health care but can't afford prescriptions. CMC volunteer Fred Fensky is among those who hope reform can improve a system that has broken their trust.
There's a lot of times where I've got questions. I can go ahead and ask her, and she can put me onto something.
Some that do have insurance just don't trust the healthcare system. So that's something that I'm able to do, is to get them to a doctor because they'll trust me before they'll trust a doctor.
Until the system changes, Knight will do what she can to point those in need in the right direction. But she says even some with access to health care cannot afford it. To them, being healthy can be a burden.
They know they can go anywhere and get health care, but then they're going to get a bill. And then that sort of negates the care that they got for the illness, because then they're stuck with this huge bill.
It's interesting to hear about that trust issue. Many feel even with health care, they won't get the treatment they need by their provider. They're hoping that reform will hold providers responsible to help fix that system to begin with.
All right, News 3's Brad Chaimson reporting tonight. Brad, thank you very much.